It's estimated that up to 5% of Americans experience Afib, and that number is on the rise. Joining us now to discuss trends and treatments is Dr. Mohamed Elshazly from the Orlando Health Heart and Vascular Institute. Welcome.
Thank you very much for having me.
Okay, so the technical name is atrial fibrillation. We call it Afib for short. What exactly is it, and why is it such a big health risk?
Yep, so atrial fibrillation, as you mentioned, is one of the most common arrhythmias around the world right now. Basically what happens is the left upper chamber of the heart, known as the left atrium, instead of contracting regularly, what it does is it kind of quivers and goes into this chaotic rhythm. And when that happens, it can make your heart speed up. So you can get heart rates in the 130s, 140s. Patients can start feeling short of breath, can have chest pain, can feel dizzy, etc. And then also what happens with it is because of this chaotic rhythm, small blood clots can form and these can cause strokes.
There's something called catheter ablation that you specialize in. It's highly effective. It's a common solution. Where does the catheter go? What gets ablated? How does this work?
Of course. Now, catheter ablation is usually an outpatient procedure, so patients would come in and go home on the same day. So here, this is a picture before we do the ablation, and you can see here areas that are pink are healthy tissue, areas that are red here are the pulmonary veins, and around them, these greenish, reddish areas, these are areas of potentially where the Afib comes from.
Okay, so maybe broken blood vessels, things like that inside the heart?
There are actually cells inside the heart that kind of trigger those Afib episodes. We basically put some IVs in their groins, and through these IVs, they go in the veins. We pass catheters up to the heart. We go to the left atrium, which I mentioned where the Afib comes from, and then we go to the pulmonary veins. There are 4 in almost every patient, and around them are sleeves of cells which produce the Afib. So our job is to go in there, go to those veins, and deliver energy that kills the cells that produces Afib.
Okay.
So our job in every patient with Afib ablation is to go in and deliver some form of energy. That can be done with radiofrequency, which is burning, cryo-freezing, which is freezing, and then there's a newer form called pulse field ablation, PFA for short. So you can see here, this is a 3D anatomical map after we've completed the ablation, and all this extra red are areas that we've been able to ablate.
This is a healthy looking heart now, and this patient doesn't have Afib anymore?
This patient doesn't have Afib anymore.
Okay. Is this permanent, or can it come back?
It can come back, of course. So we usually quote a success rate of about 70 to 80% with Afib ablation. So there's still 20 or 30% of patients might need another ablation in the future, but this could be after 5 years, could be after 10 years, and again, the vast majority might not need it at all.
It's another reason to choose well with Orlando Health. If you would like more information, you can visit orlandohealth.com/heart.